We are live.
Okay, good morning. We are back in Senate Judiciary on March 20th. We are taking up an amendment to S-193 that was made by the Health and Welfare Committee in collaboration with the Institutions Committee. That's, I believe, the deadline for committee amendments is passed. It's just the individual senators of those committees that have signed on to this bill. And it's draft 5.3 that we're working on. We have DMH and DOC in the room and on Zoom, and we're going to be hearing from Senator Lyons probably around 10:15. And in that time frame, we'll also be hearing from Ledge Council. But since we have DMH and DOC available now, we're just going to get their take on the amendment and hear their perspective. So there's three of you here. I don't know who wants to go first or how you want to handle this, but up to you folks.
I can go first. For the record, Karen Barber, General Counsel of the Department of Mental Health. Since we were last in here, we've spent lots of time in mental health and welfare and some institutions. They were really focused on ensuring the political aspects of the future facility. So what you see in front of you are changes based around that. So it's fleshing out a little bit more how it shall be operated in terms of it being therapeutic, recovery oriented, and trauma informed. We did work collaboratively as an agency and reviewed all of this language. Much of it language that we proposed, and we think those are things that make sense for this facility. Again, our goal is to ensure public safety and proper clinical treatment, including the availability of 24/7 nursing care. It also added a couple of reporting requirements, so an interim report due in October, giving the agency time to work together to come up with more of a solid plan as to a potential location, staffing needs, those sorts of things. And then there were also changes to the rulemaking section and the effective dates, acknowledging that forensic facility wasn't going to be able to be open and operational by July 1, 2026. So it gives us more time to do rulemaking. There's no need for emergency rulemaking. We could do the regular rulemaking process and then push out those dates. So we are in support of the amendments. We think it strengthens the bill. We appreciate the amount of time that the committee's put into ensuring proper clinical oversight, and believe that it's a good amendment, and we hope that you will and have to answer.
I guess my general, I think I know the answer, but just want to make sure it's clear. Based on the hearings and health and welfare changes that are made here, does this increase the focus on therapeutic healthcare and mental health care in folks in these facilities?
Yeah, so I would say that the language in here was always the plan of the Agency of Human Services was to provide this level of care, but it documents it in statute. So yes, understanding that I think that was our goal always, was to provide good clinical care, but it certainly strengthens it and makes it very clear in the statute that those are requirements.
Very good. Committee,
Just on the effective dates, is there any change from the original bill that should be commented on, or is it more or less? I'm thinking if it's included in this amendment, there's changes to the effective dates.
Yeah, so it has section 2 going into effect on July 1, and that was the one that really wasn't about the forensic facility at all, but that was about if you timed out with a misdemeanor, it would be dismissed. And then the rulemaking and the interim report sections take effect on July 1. It says that the sections around the forensic facility would be January 1, 2028. So giving us time to operationalize it. And of course, we can always come back if we think it could be operationalized sooner. And then the annual reporting is July 1, 2029, giving a year of data to be collected before that report. Did that answer your question?
Yep, absolutely. Thank you.
Any other questions? Okay. All right, thank you, appreciate it. And who wants to testify next? Is that, we declare?
We should have Commissioner Murad joining in just a few minutes. We just spoke and he's walking up from the tax building. So if you all don't mind sitting patiently for a few, that'd be great. Oh.
Welcome, Commissioner. Do you need a second to?
No.
Okay, we were just transitioning from witnesses here, and we just got a general overview from DMH about the amendment that was sent over from Health and Welfare. We're going to have Senator Lyons over here in about 15 minutes or so, and then let council as well to walk us through. But since folks were available, we just made this time for the folks to testify. And yeah, if you have a perspective or any thoughts on the amendment that they've created, happy to.
No, I'm grateful for the opportunity. For the record, John Murad, Commissioner for the Vermont Department of Corrections. I'm grateful for the opportunity, Senator, to be able to confirm that the DOC is supportive of this language and supportive of this bill. We, as I've said in other testimony, we are currently fulfilling this function. We have no issue with continuing to fulfill it in the way that we have, with the added ability to provide competency restoration services. And that obviously will probably require an amendment to our current contract with our current healthcare provider, but it's a service that they do provide in other locations. It's one that we are prepared to roll out in our own facility. And we are supportive of this. I think that it'll actually remove a certain amount of ambiguity about where people, the very small number of people who are accused of these really horrific crimes, where they go.
Any questions?
Yeah, I just have a quick, it's probably too early at this point, Commissioner. I'm just wondering, in your opinion, is there, when they talk about initial staffing considerations, staffing levels, or whatever else, are we referring to well-paid employees or DOC employees also, or?
I would assume that those staffing considerations would apply to both, but really primarily healthcare. We don't necessarily need, we don't envision changing the number of correctional staff that we have, security correctional staff. That would be our CO1, CO2s, our supervisors. Again, the majority of the people that are accused of these crimes currently and are not currently competent to stand trial are in our custody. And we are meeting those custodial needs with the resources that we currently have. And what I believe this envisions is the addition of new resources to assist with the restoration of that competency.
Thank you.
Senator.
I'm just noticing here in the language, I don't know if you have it.
I do, I can.
Sir, it says bottom of page 1, lines 70 to 19. It says, and to otherwise address clinical safety or operational considerations as appropriate, including possible operation of multiple facilities. And I'm wondering if required by the clinical needs of transferred persons. I'm just wondering about that because I don't remember our discussion touching on multiple facilities.
Yes, sir.
Thoughts on that?
Well, we do operate multiple facilities right now in that we have a female who is accused of crimes that fit the parameters of this proposed statute. And we have males who are accused of crimes that fit the parameters of this proposed statute. And therefore, those are in separate facilities already. And so some are obviously, the female is at our Chittenden Regional Correctional Facility in South Burlington, which is our only women's facility in the state. And I believe all of the other persons accused of crimes of this type, but not yet sentenced, are at Southern State Correctional Facility in Springfield.
Okay, so when it says that we'll establish and operate a locked secure forensic facility, that's in addition to what we already have, and you're saying that the multiple facilities referred to here are already partially in operation?
No, I mean that we operate secure facilities where individuals who would be eligible for this kind of treatment are held.
Okay, and maybe I'm certainly not being clear, but in other words, are we establishing one new facility here, and then there are a couple of already in place holding the people you're talking about, or are we talking about opening several new facilities?
Well, that latter question would certainly be a much larger question than any current budget contemplates. That would be a tremendously large issue.
But I'm asking because I don't know if this is, was this in the earlier drafts mentioned in multiple facilities?
No, this is 5.3 is the,
That's what I thought.
yeah.
So in other words, we introduced this phrasing of, because it's a shall, the forensic facility shall provide for the safe housing and management of persons, blah, 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 including the possible operation of multiple facilities if required by the clinical needs of transferred persons. Does that in any way obligate us going forward to have more than one new facility? That's my,
Don't know.
okay. Okay, I'm getting a head shake there.
So I don't believe the intention is to obligate multiple facilities at all. I think there's an understanding that as this process develops, we'll need to keep checking in and keep sure the right people to obligate needs. So I believe someone farther down the road, like Commissioner Murad said, we want the ability to separate people by separate gender when appropriate. We want to make sure that people are in the most safe and appropriate location. So if there were the need for something to be separated by sex, we would want that flexibility within this bill, which I think is what that language is trying to address.
Yeah, I was also going to add, I think, and it's probably an Eric question as well. At least the way I'm looking at it, that this could also allude to the possibility of providing competency restoration services in the lesser restrictive environments. So, because I know we created the possibility that a person could be technically committed to a place that isn't jail. That's my understanding. And at the same time, they could still get the competency restoration services that we're describing that are applicable to the life offense situations. That's my take on it without having heard it like counsel, but I don't know.
Yeah, I just, I do think there's an ambiguity there, but it seems like everybody involved doesn't believe that it's pointing toward multiple new facilities. So I'm fine with it.
Any other question for DOC? Any further testimony?
No, sir, not unless there's any others to some questions still. Actually, so circular because you just asked. So, no, sir.
Okay, great. Actually, I guess one general question. I asked a similar question to EMH. You mentioned ambiguity earlier. Based on what you've heard in health and welfare and what you're seeing here, does this clarify the ambiguity that the focus needs to be on healthcare and therapeutic services?
By ambiguity, I think what I meant is that we have had in the past instances in which people who are accused of crimes that fit these standards, it has been uncertain whether or not they should be inside a healthcare facility or inside a correctional facility. And I think this allows us to remove some of that ambiguity. I think it allows us still to have, as you have pointed out, the option of a custodial setting that is not necessarily a behind the double fence prison, if other such facilities exist and can be monitored through the Department of Corrections via, for example, our field services or not. But in general, what I meant by ambiguity in that particular context was the idea that there have been times where people who are accused of really terrible crimes in really credible ways are not, or move back and forth in ways that I don't think are healthy for them and I don't believe are safe for the community to move back and forth between one custodial setting and then a non-custodial setting and then back to a custodial setting as their competency either waxes or wanes or assessments of that competency change. I think this is a more standardized and specific kind of situation, and outlines that and says, no, when an individual is accused of these crimes in a credible way, they're going to remain in this location and get the services that they need in order for us to be able to give them due process, where perhaps they are able to say, no, it was not I who did it. You know, the credibility of the accusation can be dispelled in court, but that has to be a due process. And that is what's currently not always available to folks. I think this enhances their ability to access it.
Thank you. All right, so we have Senator Lyons coming at 10:15 and lead counsel coming some point in the near future, depending on how the House floor goes. So